Welcome everybody to the PT on Ice Daily Show. My name is Eric Chaconis and I teach our extremity management course as well as our primary care course. So our primary care physical therapy course is an 8-week online course designed to improve your skills in the bigger realm of healthcare, medical screening, disease management, what to look out for in a direct access environment, but also the referral-based environment, right, where we see medically complex patients as part of our typical practice. So I teach this course alongside of Morgan Denny. Morgan is an awesome clinician with lots and lots of experience in this area of our practice. We pack a lot into the 8-week time frame. We cover everything from cardiovascular, pulmonary, endocrine, immune system conditions. We dive into mental health and skin conditions, urogenital system issues, GI, hematology. It's jam-packed with a lot of very comprehensive course. Today what I want to do is just share a little bit about, within that kind of hematology realm, blood disorders, share a little bit about anemia, just start to get you kind of thinking about anemia. And so when you think of anemia, when you see the word anemia, I want you to immediately think pale and tired, right? Pale and tired. These patients are going to be weaker. They're going to be more fatigued. Exercise is potentially going to be challenging for them because they've got a reduction in hemoglobin circulating through their blood, through their system, right? And so there's some issue either with the quantity or quality of the red blood cells, of the erythrocytes. That's going to leave this individual looking pale. So when we look at their face, they generally don't look well. They look pale. They've got a little bit of a loss of color. That blood, right? The body is trying to kind of preserve, and so you're preserving that saturated blood for the vital organs. You're not seeing it in the skin as much. Another thing you're going to see too with it, is that the gums are going to be pale. The eyelids are going to be pale. A lot of these tissues that normally we see as a little bit of a darker in color, darker pink or purple color, are going to be much lighter in color because of the anemia. And so simply having the patient open up their mouth to be able to observe their gums is one nice little clinical, quick check. To be able to pull the lower eyelids down and look at the inner rim of the eyelid. That's conjunctiva pallor. That paleness on the inner rim of the eyelid is a dead giveaway for anemia, right? In the case of chronic anemia, if it's allowed to persist, you may see spoon nail or cholinekia. And that's when the nail bed here is thinner, brittle, soft, because there's been an issue with blood flow at the distal, this tissue, this nail plate, right? It's not forming to its normal thickness and tissue quality. Obviously, these patients are going to need to get lab work. That's really how it's diagnosed, and they need to be under the care of a medical provider because they have to figure out the cause. That's a really important concept I mentioned earlier. Anemia is a symptom. Anemia in itself isn't really a disease. Anemia is a symptom of some other causative factor, and so they have to figure out what that is, whether it's iron deficiency or blood loss. There are a number of different medical conditions that can cause anemia. Iron deficiency is the most common. Our patients in PT practice present oftentimes taking NSAIDs. Non-steroidal anti-inflammatories can certainly be a contributing factor here, right? If you end up having a GI bleed or a peptic ulcer because of NSAIDs, that could certainly lead to anemia. And you as the physical therapist might be the first person to pick that up, right? It's not always picked up by the medical team because you're seeing them so frequently and they recently started taking the NSAIDs. That's one side effect to look out for. The other variable to think about is just the nutritional deficiency. So there's some type of issue with either malabsorption or just not getting enough iron in their diet can be another thing to look out for. So we want to see our patients have a nice healthy diet, oftentimes a diet that is filled with kale and legumes, quinoa, lentils, soybeans. If you're interested in the kale topic, I would encourage you to go back and watch one of the previous episodes that I did on how to make a kale smoothie. That was a very popular episode Got a lot of great feedback on the kale smoothie that we made there. But obviously, for our patients, we want to make sure, we want to screen them and ask them about their diet. You have iron that is heme iron and non-heme iron. Heme iron is iron that you would get from a meat product. That's more readily absorbed by the patient. So for our vegan friends, our vegan patients, that's an important question to ask, right? Asking somebody about their diet and knowing whether or not they are vegan or not, knowing what their dietary intake looks like. You're not doing it from the angle of that the nutritionist would, but you're doing it right from the screening process and trying to make sure that patient isn't at more risk due to an iron deficiency. We mentioned exercise in the beginning. In the case of chronic anemia, once they've got it figured out and they've gotten sufficient lab work to understand the cause of why they are anemic, then exercise can play a role. You're going to be very careful. I think it's important to recognize that if you overdo it, right? If I push somebody a little bit too hard, then that can certainly have really negative impact as far as the way the patient's going to feel afterwards. Getting buy-in after you just wrecked them because they couldn't tolerate the program is really not the way to go. So erring on the side of being a little more conservative early on, slowly progressing them. And for these patients, we are just going to scale everything down big time. Our total duration of work is going to be much shorter. Our level of intensity is going to be much lower. We're going to have a much larger rest period, right? So you think about that time that they need for replenishment of oxygen to their tissues is going to be an important variable. So if I normally am pacing somebody at a normal pace of a minute to 2 minutes, 3 minutes between sets, I might extend that a little bit even longer for the patients that's anemic, depending on what we're doing in specific case. So just a few thoughts on anemia. Hopefully that inspires you. I appreciate you taking the time to listen today. It inspires you to learn more about anemia and so many of these other blood disorders that affect our patients. If you're interested in learn more about the primary care course, check it out on ptonice.com, our website. You click on online courses and you can see all the details there for our primary care physical therapy course. Thanks, everybody.
Hey, thanks for tuning in to the PT on Ice Daily Show. If you enjoyed this content, head on over to iTunes and leave us a review. And be sure to check us out on Facebook and Instagram at the Institute of Clinical Excellence. If you're interested in getting plugged into more ICE content on a weekly basis while earning CEUs from home, check out our virtual ICE online mentorship program at ptonice.com. While you're there, sign up for our Hump Day Hustling newsletter for a free email every Wednesday morning with our top 5 research articles and social media posts that we think are worth reading. Head over to ptonice.com and scroll to the bottom of the page to sign up.